we're likely to see high rates of morbidity and mortality because those individual rights can often be at odds with protections that are in the broader public interest.
A panel chaired by former Reform Party leader Preston Manning, reviewing Alberta's COVID-19 response, is calling for rule changes to ensure the Premier and Cabinet have the last say in future crises. The core recommendations of this panel, created by the Alberta government in January 2023, is that all province-wide emergencies be directed by Cabinet and implemented through the Alberta Emergency Management Agency, a change that is already in the process of being formalized through the government's Bill 6. UCalgary Associate Professor Lorian Hardcastle says these recommendations seem to help the government take full control of the system.
Public health emergency is driven by a chief medical officer of health. They are insulated from some of those political concerns. And so I worry in a province like Alberta, where the pandemic was made so political that in a future public health emergency, we wouldn't see a lot in the way of government intervention at all. I worry what that would mean for hospitals and for vulnerable people.
The report recommends in future pandemics or health crises, the Alberta Health Services is called on to make recommendations strictly related to health matters and the government to make all decisions through the emergency agency. The report also urges the government to spell that out in the new legislation. In a statement to City News, Alberta Premier Danielle Smith says, in part, at this time, no decisions have been made in response to the recommendations. Together with our caucus, we will review and analyze the report and consider the panel's recommendations as we prepare for future legislative sessions. But NDP opposition leader Rachel Notley is not pleased with the report.
Not surprised, given the opinions that Preston Manning has articulated over the many years and those of our Premier. But that is not good news for Albertans. That's not good news for our safety and the quality of our healthcare.
Hardcastle says now is the time for Albertans to speak up.
So it's a good time for the public to contact their representatives about which of these recommendations they want to see adopted. Because it's not uncommon after a report like this for the government to strike up a committee to look at which recommendations they want to adopt.
In Calgary, Henna Saeed, City News.